Hi, this is Dr. Gregory Robron, and welcome to my video bone health and wellness newsletter. And today's topic is weight bearing or something else. So are you ready to optimize your exercise routine for your bone health? Well, in this video, we will discuss the differences between weight bearing and load bearing exercises and why load bearing exercises are crucial for improving bone density. So please note that the information in this video is not intended to diagnose any medical condition or offer medical advice. The purpose of this video is to provide viewers with information that can help them make informed decisions and have informed discussions with their healthcare providers, family members, and loved ones. I received an email from a new client who has been an avid walker for years, yet her bone density is declining in spite of her being quite active, and she's uncertain about her current exercise routine and what is being recommended to her. So I'll go ahead and read the email. So, dear Dr. Greg, I hope this message finds you in good health. I'm reaching out to you as I have been recently diagnosed with osteopenia and osteoarthritis, and I'm concerned about my bone health. My doctor has suggested weight-bearing exercises to improve my bone density, but as a regular walker, I am uncertain if this will be enough. Another doctor recommended incorporating weights into my exercise routine to see an important improvement in bone density. Despite my consistent walking routine, I have not noticed any significant improvement in my bone density, and I worry about my condition because it might be worsening. Therefore, I am eager to explore other options that may help me maintain my bone health. Understand that my conditions may limit my ability to engage in certain types of exercises, but I am open to any suggestions that could be safe and effective for me. I have heard that resistance training and balance exercises may be beneficial, but I am seeking professional guidance to ensure that I am on the right track. I would appreciate any assistance and advice and that you could provide me and help me understand the most suitable exercises for me. Thank you for your time, and I look forward to hearing from you soon. Okay. First, the term weight bearing can be confusing because it is a vague term that can be interpreted in many different ways, and it is often prescribed by well-meaning healthcare and exercise professionals. For example, someone may assume that weight-bearing exercises simply mean lifting weights or performing high-impact exercises, while others may assume it refers to exercise that involve standing or supporting their own body weight, such as walking. However, the appropriateness of exercise prescription depends on an individual's specific conditions and goals. So let's review the principle of exercise prescription, the idea that the type, intensity, and duration of exercise should match the desired physiological and functional changes. This means tailoring your exercise program to your individual goals and needs. For example, if you want to improve cardiovascular fitness, running or cycling would be appropriate, whereas resistance training like weightlifting would be better for muscular strength. So to determine the appropriate intensity and load for resistance training, I like to use the Oddvar Holton diagram. Now, Oddvar Holton was a Norwegian physiotherapist, and he developed the philosophy of medical exercise therapy as a method to determining training intensity. Now, this diagram shows the percentage of intensity correlated with the repetitions performed of an exercise, which allows us to determine weight or resistance to use for specific goals, such as building muscular strength, improving endurance, promoting circulatory changes of tissue, or creating signaling for bone tissue remodeling. For instance, if an individual wants to improve their muscular endurance, they will perform high repetitions of a lower weight. In contrast, if they want to build muscular strength, they will perform low repetitions with a heavier weight. Now, using this chart, we have an idea of the weight or resistance that should be used. Now, when we talk about weight-bearing exercises, these are activities that place stress on the body through the force of gravity. You're bearing your weight solely. Now, this would typically put most individuals towards the base of the Oldvar-Holton diagram. Examples of weight-bearing practices include walking, running, hiking, air squats, and stair climbing. Walking, which is commonly prescribed as a bone-building exercise, most individuals can perform numerous reps without fatigue. Running, not as many. Air squats, maybe even fewer, but you get the idea. There is nothing specific. These exercises place little mechanical load on the bones. There is some suggestion in the literature that weight-bearing activities can stimulate bone to become stronger. However, this may not be enough signaling to overcome other factors contributing to bone loss or preventing bone formation. Now, when we look at the scientific literature, bearing your body weight typically is not enough to improve bone density in most people. This is where the term load-bearing comes in, or load-bearing exercises. I like this term better than weight-bearing. Now, load-bearing exercises are activities that apply external forces or additional weight to the skeletal system, such as resistance training. Load refers to the external force greater than one's own body or body segment, while bearing refers to the internal forces created by the muscles in response to that external force. This concept is crucial for bone health. By applying external force, load-bearing exercises generate high internal forces through muscular activation, which activates cells responsible for growth, remodeling, and upkeep of bone tissue. This can be achieved through various exercises such as Olympic-style lifting, CrossFit exercises, jumping or bounding, and high-intensity isometrics. These activities tend to sit at the peak of the Oldvar-Holton diagram, a repetition range of 1 to 5 with a load around 85% to 100% of maximal output is the prescription range if the goal is to develop strength, specifically power, and muscular recruitment. This high level of muscular recruitment results in improved bone signaling followed by bone remodeling and density changes, especially in the spine and hips, which are common sites for fractures in older adults. High-intensity isometric exercises are a safer option for individuals at higher risk of fractures because they do not involve the rapid and forceful movements characteristic of high-impact exercises. These exercises involve holding a static position without movement, generating high internal forces via muscular activation. Both high-intensity isometrics and heavy load-bearing exercises share the common trait of generating high internal forces via muscular activation. These forces activate the cells responsible for the growth and upkeep of bone tissue, making both types of exercises effective for maintaining and improving strength and bone structure. Now, high-intensity isometric exercises are less stressful on joints, making them helpful for people with arthritis or previous joint injuries. In fact, there is a suggestion in the literature that this form of exercises reduces joint pain. In summary, exercise programs should be tailored to an individual's goals and needs. Different exercises create different outcomes. While weight-bearing exercises place some stress on bones through gravity, load-bearing exercises generate internal forces through increased muscular activation. They are particularly essential for maintaining or improving bone density and strength. High-intensity isometrics effectively improve muscle strength, balance, and bone density, making them safe and accessible options for individuals at any fitness level. Therefore, incorporating load-bearing or high-intensity isometric exercises into an exercise routine can help maintain and improve bone health and reduce the risk of fractures. So, if you have a question or a challenge that you'd like to get my help with, please visit www.osteostrongfl.com. And if you happen to be in the Southwest Florida area, I would love to meet you. If you're traveling out of the area and you'd like to visit an OsteoStrong facility, go to www.osteostrong.me and you can find a studio near you. So until next time, I'll see you then.